Welcome back to Ask Angelina, and in today's episode, we are going to talk about the ongoing issue of Taiwan's hospitals being understaffed and overwhelmed with the number of patients they're receiving daily. I invited a special guest to join my podcast today to discuss this issue. So, do you want to introduce yourself?
Yeah, hi, I'm James. I'm an undergraduate at USC. I'm also Angelina's brother. I recently did a shadowing program in Taiwan, Kaohsiung, as they call it. And in this shadowing program, I experienced quite a lot. And Angelina, would you like to go on more about that?
Yeah, so I actually wanted to ask you about the shadow program and what did you learn from it about the healthcare workers?
Yeah, I think I got a unique insight in terms of both the double-edged sword that is the Taiwan's healthcare system. In many ways, the Taiwan healthcare system is quite reversed from the U.S. healthcare system. The U.S. healthcare system benefits the doctors and the insurance companies that fund each hospital, whereas in Taiwan, it primarily helps the patients that come into the hospital.
Yeah, through the NHI smart cards that people have as well.
Yeah, we call them 健保卡 here. And essentially, with these 健保卡, these insurance cards, patients can automatically go into any doctor, any clinic they want, and essentially get practically free healthcare.
Yeah, like I said in the previous episode, these three things, accessibility, cost, and choice, is a really important thing that people want from a Taiwan health insurance program. So this program was really beneficial, but then at the same time, these physicians are seeing up to 90 patients a day. So it's really getting harder for hospitals to keep up due to the lack of nurses and doctors available. So families and friends are being needed, and they're being expected to remain at their patient's side and attend all their daily needs. So what do you observe from this program, especially being on the doctor's side of things?
Yeah, sure. I think this answer could be split up into two different parts.
Okay.
One is the outpatient experience, which is like the clinician experience in terms of clinics, people coming in and going out. They're not staying in the hospital. They're just there for an appointment. This can also include the emergency room and just basic clinic stuff. There's also the inpatient experience, which is what the nurses experience in terms of rounding, having to deal with the patients all the time, and the massive, and I mean immensely huge population of patients that come in every single day to be treated. And they often stay for quite a long time. So I think specifically about the outpatient experience, doctors are often overwhelmed and dealing with a lot more patients than the U.S., up to 5 times more. Doctors in the U.S. typically deal with about 10 to 20, whereas, for example, in my colorectal surgery rotation, I saw a patient deal with 50 to 100 patients within a span of 4 hours.
Yeah, it's getting harder for hospitals to try to keep up with these amount of patients because of the lack of nurses and doctors. They're showing the immense amount of stress that they're having. And also, like families and friends, they're expected to remain at the patient's side and attend to their daily needs. So the nurses can be available to do other things. However, overall, this is not a good issue for doctors and nurses. With long hours and low salaries, the amount of healthcare workers or people who want to become healthcare workers are decreasing immensely. So what do you think about this issue?
I think this also moves into the inpatient experience as well. In terms of nurses and doctors, they're actually quite dwindling. Doctors actually have a stable career in terms of the workforce in Taiwan, but they're still not getting paid enough for the amount of hours they work. Now, it's arguable that the same thing could be said for doctors in the U.S., but doctors in the U.S. versus Taiwan get paid far more than what they do in Taiwan. Now, specifically for the nurse workforce, about 10% of the hospital I was working at, 10% of the nurses' workforce had left the hospital entirely. This was mainly due to salary reasons, because even though it's a job that is rewarding for them and truly something that they believe in, roughly 70 of them could not pay their own bills with the salary that was given to them. This has caused quite a discrepancy between in terms of what Taiwan can do for these nurses because of this national health insurance thing that prevents them from giving more money to the nurses.
Yeah, but the thing is, you also have to see that this NHI program is very beneficial for the patients. But the thing is, at the same time, the doctors and nurses are suffering from this issue. And nurses are being paid roughly 648,000 NT to 920,000 NT, which is roughly about 20,000 to 28,000 USD. So that is very little for a salary, and they're working like 16 hours in a hospital. And it's pretty long for this low salary.
Yeah, these shifts are pretty brutal as well. In terms of the national health insurance, since there's so many patients that they have to take care of, nurses are often assigned 5 to 10 patients each and every single time. And so they cycle through 5 or 10 patients at a time, which causes them to be overworked. It causes the staff culture to be a lot more stressful than it is. And it also, this national health insurance program causes patients to feel more entitled to things that they wouldn't be without it. For example, they often ask the nurses and trouble them with minor tasks that they could probably do themselves. They treat these nurses like lesser than, because it's a culture in Taiwan that hospitals will provide everything. This is the type of culture that national health insurance has created.
Taiwan thinks healthcare is a right, so obviously they treat it as very important to them. And since Taiwan believes strongly in their healthcare system, how do you think we should solve this as the next generation and get more nurses and doctors to help out, especially in Taiwan hospitals?
Well, I think that one of the main reasons that, let's start from the beginning. ER doctors, I talked to an ER doctor, and he said that the 4 main factors that cause nurses to leave in the first place is the work environment they work in, and the patients make it very hard, the culture that is within a workplace, the salary they receive, and also the challenges they face. I think these 4 factors are pretty important to improve on a hospital scale. Every single hospital can improve their work life in some way, and I think that's something that's important for these nurses. But I think more importantly, to figure out the root of the problem, the national health insurance system needs to change. While it benefits the patient to a very, very good level, the doctors and nurses and the rest of the healthcare system and the workers are affected. Now, I think that in the future, Taiwan could be looking at something of a hybrid between the American and the current Taiwan healthcare system in order to help these doctors and nurses.
Yeah, so do you think that we could get doctors and nurses from perhaps other countries to come to Taiwan and help out in these hospitals?
Yes, that actually is a current solution right now. In terms of what the Taiwanese government is trying to do, they're actually trying to replicate the Singaporean system of importing different doctors and nurses. So essentially what Singapore is doing currently is that they're trying to reform their education system, and they have successfully, to be primarily based around English and Chinese. And so by adding English into the mix, Taiwan could benefit from getting international doctors to come all over to Taiwan. Since English is the universal medical terminology, is used in the medical terminology, I think it would be super beneficial if Taiwan emphasized that fact. And it will only be a matter of time before international doctors keep coming to Taiwan.
Yeah, I think the language plays an important role in this issue because the Taiwanese government needs to have more emphasis on English education and help students start learning English when they're young, which helps the next generation of healthcare workers succeed. So what do you think about that?
Yeah, I completely agree with that. There's also this, I also want to emphasize that in terms of the outpatient experiences, there's something called gatekeeping specialty services. This essentially means that when patients come into the ER, also another difference is that they come usually by walking and not by an ambulance, because everyone lives so close by. Another Taiwanese infrastructure. That's not the point. The main point is that there's a thing called gatekeeping of specialist services. When people walk into the ER or when they arrange time for a clinic, they can arrange it to a specific specialty. And often what they do is that they redirect patients to different specialties, to different clinics at many different times, which causes these specialty services to be overloaded. Specialty services include like neurosurgery, colorectal surgery, cardiovascular surgeries, endocrinologists. These different specialties within medicine are being overwhelmed by patients that frankly have very easy to deal with issues. I once saw a patient that came in with just a cough to the otolaryngologist, and out of all the things that day, he probably could have done without having to see 30 of those different patients. Now, by gatekeeping these specialist services won't decrease the amount of quality of these healthcare, but it will actually increase it because it gives more time for the specialists to pay attention to the patients that actually need the help, rather than have short consultation times of 5 to 10 minutes per patient.
Oh, yeah, I see. But what do you think about the younger people in Taiwan who want to be healthcare workers and are going to face these same exact issues that current doctors and nurses are facing right now in Taiwan? What do you think about that?
Well, I think that the insurance system is likely going to change in terms of how the government is going to reform them. There are currently some bills being wafted around in Parliament, but I think that in terms of how many people of the younger generation are still going to want to become doctors and nurses, I still think being a doctor or nurse is of cultural relevance to Asian families. They often pressure their children or to pursue these medical careers. And with these medical careers going into the healthcare industry, they will often find themselves in a hopefully better environment than we have today. Now, there hasn't been any organized healthcare strike that I know of, or any movement to reform this current healthcare system because it's so beneficial to the patients. But I could see one in the foreseeable future.
Yeah, thank you for that insight. I actually agree with what you said, because I think that the healthcare system in Taiwan will change in the foreseeable future. And because of what I've heard on the news, a lot of people are becoming interested in what Taiwan's doing right now. So this could possibly mean that more foreigners or people living outside of Taiwan coming to Taiwan and visiting and actually helping and inspire change in different aspects of Taiwanese society. So thank you so much, James, for joining me on my podcast. And do you have anything else you would like to add?
No, nothing else really. But I think that Taiwan's healthcare system will change the world in terms of what we can see in the future. And I think that a lot of other countries could definitely learn on it, and it could even be improved in the future.
Great. Thank you so much, James, for coming on my podcast. And thank you for the listener who is listening. And I hope you enjoyed today's episode and gained some insight on understaffed healthcare workers in Taiwan. Stay tuned for the next episode, and bye!